Hello everyone. In this video I will be talking on anatomy of larynx. In the part 1 video we discuss about the gross anatomy and the laryngeal cavity, and in this video I will be talking on the skeletal framework and nerve supply of the larynx. So we know that larynx is made up of series of cartilages that are connected with each other by fibrous membrane and ligaments, and it also having several muscles that bring the movement between them. And we will see in subsequent slides about each and every component of laryngeal skeletal system. But before that, we have to know one thing more, that is, though the hyoid bone is closely associated with the larynx, this is the hyoid bone, and this is closely associated with the larynx. However, it is considered as a separate structure and not included in the larynx. So we can see here in this image, this is the thyroid cartilage, the epiglottis, cricoid, Arytenoid, Corniculate cartilage, and this one is cuneiform cartilage. So we can see in this picture that the larynx is made up of series of cartilages that are interconnected with the membranes, and somewhere they are also connected with the ligaments. So this is the cross section of the larynx, and this is the larynx from this outer aspect. So altogether the larynx having the 9 number of cartilages. They are classified into two groups as a paired group and unpaired group. So in the paired group we have in the arytenoid, corniculate and cuneiform. And we can see here this one is arytenoid, this is corniculate, and this is cuneiform cartilage. And these three are paired cartilages. So altogether they are 6 in number. And larynx having three unpaired cartilages. These are the thyroid, cricoid and epiglottis. This one is the cricoid cartilage. This is the thyroid cartilage that has been sectioned, and you can see this from the outside. It's appear like this. This is thyroid cartilage. This one is epiglottis. And also we can notice one thing, that the cartilage, those who are unpaired, are bigger in size, like the epiglottis, thyroid, and the cricoid. And those who are paired, they are smaller in size. For example, arytenoid, corniculate, and cuneiform cartilage. If you see the types of the cartilage, then we will notice that the thyroid, cricoid, and the basal part of the arytenoid, this is the basal part of the arytenoid, are composed of hyaline cartilage. And the apex of the arytenoid, this is the apex of the arytenoid, and corniculate and cuneiform cartilage, along with epiglottis, are made of the elastic cartilage, and they do not ossified. So coming to the individual cartilage, so let's start with the thyroid cartilage. The thyroid cartilage is the largest and the most prominent cartilage among the laryngeal cartilage, and it acts as a shield to protect the larynx from the front. So we can see here, this is the thyroid cartilage, this is the thyroid cartilage, and here the thyroid cartilage, it is shown alone. So the thyroid cartilage, it covers the larynx from the all aspect except the posterior. So it covers the larynx from the anterior and the lateral way, and it forms a shield that protect the larynx from the front. And if you see the parts of the thyroid cartilage, it's having two quadrilateral lamina, on one on each side. This is the quadrilateral lamina, one on each side. Here this is the quadrilateral lamina, and they join in front and form a angle, and this is called the thyroid angle, which is acute in case of male and it is obtuse in case of females. And as the thyroid angle is acute, it forms a prominence over the larynx. Because of that, it is called as Adam's apples. And also the thyroid cartilage having the, on the back side or posterior aspect, superior cornu, there's a superior horn and the inferior horn. And this inferior horn articulates with the cricoid cartilage. So the thyroid cartilage is having two lamina, one on each side, thyroid angle, and a superior and inferior horn on each side. And if you see the structure that are attached to the thyroid cartilage, let's start from the structure that are attached over the posterior surface. This is the posterior surface of the thyroid cartilage. This one is the anterior surface of the thyroid cartilage. So we can see that the structure that are attached are from above downward. In the middle planes are Thyroepiglottic ligament. This is the thyroepiglottic ligaments that attach the thyroid cartilage with the lower end of the epiglottis. Then we have a pair of the vestibular ligament. So we can see here, this is the vestibular ligament. Anteriorly it is attached to the thyroid cartilage, and also a pair of the vocal ligament. They are also attached to the thyroid cartilage. So we can see one on each side, the thyroid vocal ligament, then the vestibular ligament, and the pedicles of the epiglottis that is attached to the thyroepiglottic ligament. And in this image we can see this is the white, the gray one is the vocal ligament, and it's attached on each side. And on the outer surface of the thyroid cartilage, they had one oblique line. The thyroid cartilage is having an oblique line. You can see here, this is the oblique line over the thyroid lamina. And on the oblique line from above downward, the muscles that are attached are thyroid, then the sternoid, and inferior constrictor. And some muscles are attached to the posterior margin of the thyroid cartilage, and the structure that are attached to the posterior border of the each lamina are the platopharyngeus muscles, salpingopharyngeus muscles, and stylopharyngeus muscles. Now coming to the cricoid cartilage. The cricoid cartilage, it is in signet ring shape with anterior narrow arch and a posterior broad lamina. So this is the cricoid cartilage. We can see here this part is the anterior part and this one is the posterior part. So anterior part is narrow and the posterior part it is broad and form the lamina. It's completely encircle the larynx and it forms the base of the larynx. So we can see here this is the cricoid cartilage is the lowermost part of the larynx. So it forms the base of the larynx over which all the other cartilage based on. And this cricoid cartilage corresponds to the cervical 6 vertebra, and the lower margin of the cricoid cartilage forms the lower border of the larynx. And if you see the posterior aspect of the cricoid cartilage, it's having a median ridge, and on the both side of the median ridge there is a depression. And if you see the epiglottis, it is something like a leaf. It is a leaf-like structure that extends behind the hyoid bone. So this is the hyoid bone. We can see it is behind the hyoid bone and it is attached to the hyoid bone with some ligaments. We will discuss on subsequent slides. And if you see the structure of the epiglottis, on the upper part it is broad and the lower part it is narrow, and the narrow part, that is the pedicle like things, it attached with the thyroid cartilage. So the upper broad end is free and form the upper boundary of the laryngeal inlet. Lower stalk is attached to the posterior surface of the thyroid cartilage. The anterior surface is connected to the base of the tongue by the median and the lateral glossoepiglottic fold. So this is the epiglottis. Here is the base of the tongue. So it is attached with the base of the tongue by median and lateral glossoepiglottic fold. Arytenoid cartilage, they are the paired cartilage, one on each side. They are two in number and they are pyramidal in shape. So if it is the pyramidal in shape, they will have a base, three surface. This is the medial surface, the lateral surface, and the posterior surface, and the one apex. So this is the apex. We can see this is in the pyramidal in shape, having two process. That is, one is the muscular process and another one is the vocal process. So this one is the vocal process that is projected anteriorly or directed anteriorly, to which the vocal ligament is attached, and one the muscular process that is directed laterally. And if you see the base of the arytenoid, it is concave in shape. So this is concave and this surface articulate with the upper border of the lamina of the cricoid cartilage. So we can see in this image, this is the arytenoid, this is the cricoid. On the upper border of the lamina of the cricoid cartilage, the base of the arytenoid articulate with it. The corniculate cartilage, that is also called the cartilage of Santorini. They are two in number, are small conical nodules. So we can see here, this is the corniculate cartilage, one on each side, and they articulate with the apex of the arytenoid cartilage on each side. They are directed posteromedially and lie in the posterior part of the aryepiglottic fold. So this is the aryepiglottic fold. So we can see here this is the actual location of the corniculate cartilage. The next pair cartilage is the cuneiform cartilage. They also call the cartilage of Wrisberg. They are also two in number. They are tiny small rod-shaped cartilage and they lie in the posterior part of the aryepiglottic fold just above the corniculate cartilage. So we can see here this one is the cricoid cartilage, here the arytenoid. Above the arytenoid it is the corniculate cartilage and above that it is cuneiform cartilage and they are small rod-shaped cartilage and they lie on the aryepiglottic fold. So coming to the joints of the larynx. The joints of the larynx includes cricothyroid joint, cricoarytenoid joints and arytenocorniculate joints. So if you see the cricothyroid joint, it is a plain synovial joint between the inferior cornu of the thyroid and the side of the cricoid cartilage. So this is the facet for the inferior horn of the thyroid which articulates with the cricoid. So this is cricothyroid joint. And we have to remember one more thing is that recurrent laryngeal nerves enter into the larynx very close to this joint. And the movement that takes place in these joints are the rotatory movement and the gliding movement. The rotatory movement happens in the axis that passes transversely through the both thyrocricoid joints. And if you see the direction of the movement, it's having rotation movement. So when it rotates in anterior direction, it moves the thyroid cartilage in anterior and downward direction. So it moves in this direction. And there is also some amount of the gliding movement of the cricoid takes place around the lower horn of the thyroid cartilage. And if you see the cricoarytenoid joint, it is also a plain synovial joint between the base of the arytenoid and the lateral part of the upper border of the lamina of cricoid cartilage. And the movement that takes place here is also the rotatory movement and the gliding movement. But here the rotation movement takes place in the vertical axis, thus bringing adduction and abduction of the vocal cord. So depending upon the which muscle is contracting, the arytenoid rotate outward or in inward direction. If it's rotate in outward direction, it causes abduction of the vocal cord, and if it rotate in inward direction, it causes adduction of the vocal cord. And also there is some amount of the gliding movement takes place between the arytenoid and the cricoid cartilage, and when there is a gliding movement, the arytenoid moves towards or away from each other, thus closing and opening the posterior part of the glottis. So when it moves towards each other, they close the glottis, and if it moves away from each other, they open the glottis. The another joint is the arytenocorniculate joint. This is the arytenoid and this is the corniculate. So the joint between the arytenoid and the corniculate is the arytenocorniculate joint, but it does not having any significant function. So coming to the ligaments and the membranes of the larynx, and these ligaments and the membranes are responsible for connecting the different cartilages of the larynx and form a single unit. So broadly they are classified as intrinsic and extrinsic group. In the intrinsic group, they are the part of the inner broad sheet of the fibroelastic tissue that form the inner tube of the laryngeal cavity. And the extrinsic group, they are situated outside the inner tube of the laryngeal cavity and made up of fibroelastic tissue. In the intrinsic group, the membrane and the ligaments are cricovocal membrane, vocal ligament, quadrangular membrane, vestibular ligaments. And in the extrinsic group, the membrane and ligaments are the thyroid membrane and ligament, cricotracheal ligaments, thyroepiglottic ligaments, hyoepiglottic ligaments, and cricothyroid ligament. So, if you see the extrinsic ligaments and the membrane of the larynx, so we can see from this image. So the first is the thyroid membrane. So we can see from this image that the thyroid membranes extend from the upper border of the thyroid cartilage to the upper border of the hyoid bone. It ascends behind the concave surface of the hyoid bone and attached on the posterior superior aspect of the hyoid bone. So it forms a gap between the thyroid bone, the hyoid bone and the thyroid membrane. And here there is one bursa that is called the subhyoid bursa is located. And this thyroid membrane is thickened at the median part and the lateral part, and this thickened part forms the thyroid ligaments, the median thyroid ligaments and the lateral thyroid ligaments. And in the lateral thyroid ligaments there is small nodular cartilage. These are the small nodular elastic cartilages are there. These are called the cartilagotriticea. Another extrinsic another extrinsic ligament is the cricothyroid ligament that connects the lower border of the thyroid with the upper margin of the cricoid cartilage. Another extrinsic membrane is the cricotracheal membrane. It connects the first ring of the trachea with the lower margin of the cricoid cartilage, and anteriorly it is thickened to form the cricotracheal ligament. Other extrinsic ligaments are the hyoepiglottic ligament. Hyoepiglottic ligament attaches the posterior aspect of the hyoid bone with the anterior surface of the upper part of epiglottis. Another ligament is thyroepiglottic ligaments that attach the posterior aspect of the thyroid to the lower narrow part of the epiglottis. So we can see in this diagram, this is the thyroid cartilage and this is the lower narrow part of the epiglottis. It is attached with the thyroepiglottic ligament. Now coming to the intrinsic ligament and the membrane of the larynx. The intrinsic ligament and membrane are the part of the broad sheet of fibroelastic tissue which forms the inner tube of the laryngeal cavity outside the mucous membrane. So we can see here this is the thyroid cartilage, this is the cricoid cartilage, and we can see the inner tube of the laryngeal cavity is formed by the intrinsic membrane and the ligament. And the intrinsic membrane is divided into two parts by the sinus of the larynx. The part above is called the quadrangular membrane and it arises from the lateral margin of the epiglottis and is extended up to the arytenoid and it having the lower free border. And the part below the sinus is the cricovocal membrane that is also called conus elasticus. So we can see in this image that this pink one is the quadrangular membrane that arises from the lateral margin of the epiglottis and it is continue up to the arytenoid, and this one is the cricovocal ligament. It started from the cricoid cartilage in the upper part of the cricoid cartilage and it's having the free upper end at the level of vocal ligament. So this is the vocal ligament, this is the sinus of the larynx, this is the vestibular ligament. So the membrane that is above this one is quadrangular membrane, and the membrane below the vocal ligament up to the cricoid cartilage, this is the cricoid cartilage, is cricovocal membrane. So coming to the muscles of the larynx, the muscles of the larynx are also classified into an extrinsic group and intrinsic group. So the extrinsic group means the muscles that are attached the larynx to the surrounding structure. That means the outside the larynx, and they are responsible for the movement of the larynx as a whole. All are paired muscles. All muscles elevate the larynx except the sternohyoid that depress the larynx. And in intrinsic group, these are the muscles that attach the laryngeal cartilage to each other and thus bring the movement among the laryngeal cartilage. In the extrinsic group, the muscles are the platopharyngeus, salpingopharyngeus, stylopharyngeus, thyroid, and sternohyoid. In the intrinsic group, they are further classified as the muscles that close the laryngeal inlet. And the muscle that is responsible for closing of the laryngeal inlets are the oblique arytenoids, aryepiglottic muscles, thyroarypiglotticus muscles. And another group is the muscle that abduct or adduct the vocal cord. These are the posterior cricoarytenoid, lateral cricoarytenoid, and transverse arytenoid. Then the third group is the muscles that increase or decrease the tension of the vocal cord. These are the cricothyroid, vocalis muscles, and Thyroarytenoid muscles. Now let me see the individual muscles. So Cricothyroid muscles, it is triangular muscle. You can see here. The origin are the anterolateral part of the arch of the cricoid cartilage. This is the arch of the cricoid cartilage, and it arises from the anterolateral part of the arch of the cricoid cartilage and inserted over the inferior cornu and the adjacent part of the lower border of the lamina of thyroid cartilage. This muscle is supplied by external laryngeal nerves, and you have to remember here one more thing. This is the only intrinsic muscles of the larynx that is supplied by external laryngeal nerves. All other muscles are supplied by recurrent laryngeal nerve. And the action of this muscle is to move the thyroid cartilage in downward and forward direction. That leads to lengthening and tensioning of the vocal cord, also causes adduction of the vocal cord. The next muscle is the oblique arytenoid. As the name itself suggests, it is oblique. So this is the oblique arytenoid muscles. It arises from the muscular process of the one arytenoid cartilage and it inserted to the opposite apex of the arytenoid cartilage. So this is the muscular process of the arytenoid. This is the apex of the arytenoid. So the opposite muscular process is started and end with the apex. And this muscle is supplied by the recurrent laryngeal nerves and its action bring closure of the laryngeal inlet. So we know that when this muscle contract, they bring the arytenoid cartilage closer to each other and also because of that it closes the laryngeal inlet. The next muscle is the Aryepiglotticus. So the some fibers of the oblique arytenoid muscles discontinue and it attached over the lateral margin of the epiglottis. So origin from the muscular process of the arytenoid cartilage. This is the muscular process of the arytenoid cartilage. It continues as oblique and some fibers will continue as Aryepiglotticus and it inserted over the margin of the epiglottis. The nerve supply is again the recurrent laryngeal nerves and its action closes the laryngeal inlet. So when it contract, this is the Aryepiglotticus. So when it contract, it closes the laryngeal inlet. So it will bring down the epiglottis and closes the inlet of the epiglottis. The next one is transverse arytenoid muscle. So as the name suggests, it is a transverse muscle. This is the transverse arytenoid that connects the opposite arytenoid cartilage. So the origin is the posterior surface of one arytenoid and insertion to the opposite posterior surface of the another arytenoid. Nerve supply again the recurrent laryngeal nerves and when it contracts it brings the both arytenoid cartilage closer to each other that leads to adduction of the vocal cord. Now coming to the lateral cricoarytenoid. So this is the lateral cricoarytenoid. As the name suggested, it arises from the upper border of the cricoid cartilage on the lateral part. This is the cricoid cartilage upper border lateral part. It arises and inserted over the muscular process of the arytenoid cartilage. So this is one is the muscular process of the arytenoid cartilage. So when it contracts, so it moves the muscular process anteriorly. Thus, it rotates the arytenoid cartilage on the vertical axis, bringing the vocal process towards the midline. So it brings adduction of the vocal cord. So we can see in this image when it contracts in this direction. So it rotate the arytenoid cartilage in such a way that the vocal cord goes towards the median plane and bring the adduction of the vocal cord. Again, the nerve supply is the recurrent laryngeal nerve and action is adduction of the vocal cord. Posterior cricoid arytenoid. As the name suggests, the origin is from the posterior surface of the cricoid lamina lateral to the median ridge. So this one is the median ridge. This one is the posterior aspect of the cricoid cartilage. This one is the lamina of the cricoid cartilage. From here it arises. This one is the posterior cricoarytenoid muscles and it inserted over the muscular process So as we can see in this diagram, when it contracts, it again rotates the arytenoid in the vertical axis but opposite to the action of the lateral cricoarytenoid. So when the muscle contracts, it moves the vocal process away from the midlines. So it leads to abduction of the vocal fold. Again, I am repeating, when it contracts, the muscular process go in the posterior directions. It rotates the vocal process away from the midline, so it brings the abduction of the vocal cord. And again, the nerve supply is recurrent laryngeal nerves, thyroarytenoid muscles. So as the name suggests, origin is from the posterior aspect of the angle of the thyroid cartilage. This is the thyroid cartilage, it arises from the posterior aspect, and it will inserted over the anterolateral surface of the arytenoid cartilage. That's why thyroarytenoid muscles. So this on the cross section, it is thyroarytenoid muscle. When it contract, so it contract, it relax the vocal ligament. So we can see in this image, this is the thyroarytenoid muscles. When it contracts, so it shortens the anterior posterior length of these muscles, and it will bring relaxation in the vocal ligament. So it relaxes the vocal cord. Again, the nerve supply is recurrent laryngeal nerve. The next muscle is the vocalis muscle. As the name suggests, the vocalis muscles lie in the vocal cord only. So it lies within the vocal fold, just lateral and cranial to the vocal ligament. This is the vocal ligament, and this lateral to the vocal ligament is the vocalis muscles. And it originates from the thyroid angle and the anterior part of the vocal ligament. So this one is the thyroid angle, this one is the origin, and inserted over the lateral surface of the vocal process. This one is vocal process, so it arises from here, and insertion is over the vocal process lateral surface. Nerve supply is again recurrent laryngeal nerve, and action, it causes the segmental tension of the vocal cord, and it modulates the voice. Now coming to the nerve supply of the larynx, the nerve supply of the larynx is divided into two components, the motor nerve supply and the sensory nerve supply. So we can see from this picture that the nerve supply to the larynx is from the superior laryngeal nerves, that divided into internal laryngeal nerve and external laryngeal nerves, and the branches of the vagus nerve, that is recurrent laryngeal nerves on both sides. Internal laryngeal nerves mostly give rise to the sensory innervation, and the external laryngeal nerves supply the one muscles, that is cricothyroid muscles. All intrinsic muscles of the larynx is supplied by the recurrent laryngeal nerves on the both sides except the cricothyroid, which is supplied by external laryngeal nerve. So the motor supply of the larynx is mostly by the recurrent laryngeal nerves and external laryngeal nerves. All the intrinsic muscle of the larynx is supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by the external laryngeal nerve. And if we see the sensory nerve supply, the mucous membrane above the vocal fold is supplied by the internal laryngeal nerve. So this is the internal laryngeal nerve that pierces the thyroid membrane and goes inside and supply the sensory component of the larynx above the vocal fold, and below the vocal fold recurrent laryngeal nerves give rise to sensory nerve supply. So before we end, there are some important points to remember in larynx. These are the thyroid cartilage is the largest and most prominent cartilage of the larynx. Cricoid cartilage, it is completely encircle the larynx lumen and also give the foundation stone of the larynx over which all the other cartilage based. The posterior cricoarytenoid muscles is the only muscles that causes abduction of the vocal cord. All other intrinsic muscles are adductors, and also it is called the safety muscles of the larynx. The cricothyroid muscles, which is the chief tensor of the vocal cord and also called as the tuning fork of the larynx. The narrowest part of the larynx is rima glottis, that is the gap between the vocal fold. All the intrinsic muscles are supplied by the recurrent laryngeal nerve except the cricothyroid, which is supplied by the external laryngeal nerve. And last, the all intrinsic muscles are paired except transverse arytenoid. With this, we come to the end of this video. Thank you for watching this video.